Welcome to another episode from the Veterinary Research Channel. Today we are diving deep into a fascinating study that explores the world of canine urinary tract infections, or UTIs, specifically focusing on those caused by Enterococcus bacteria. This research sheds light on how these infections differ from those caused by other bacteria, offering valuable insights for veterinarians and dog owners alike. To begin, let's set the stage with some background information. Enterococcus species are recognized as significant contributors to bacterial cystitis and subclinical bacteriuria, also known as SBU, in dogs. In fact, they often rank as the second or third most common bacteria isolated from canine urine cultures, accounting for a notable percentage of cases. Now, what makes Enterococcus infections different? Previous research has hinted that these bacteria may colonize the urinary bladder when a dog's local or systemic defenses are weakened. Think of it as opportunistic invaders taking advantage of a compromised immune system. Additionally, Enterococcus is frequently found alongside other bacteria in polymicrobial urinary tract infections. This means that multiple types of bacteria are present, making it sometimes tricky to pinpoint the exact role Enterococcus plays in the infection. To unravel these complexities, a team of researchers set out to compare Enterococcus bacteriuria with bacteriuria caused by other agents. Their goals were threefold. First, to determine if lower urinary tract clinical signs were more common with Enterococcus infections. Second, to investigate whether Enterococcus bacteriuria was more prevalent in dogs with systemic health issues. And third, to assess if the resolution of clinical signs following antimicrobial therapy differed between dogs with Enterococcus infections and those with other bacterial infections. The researchers hypothesized that Enterococcus would be more common in dogs with subclinical bacteriuria and polymicrobial infections, and that underlying health conditions would increase the likelihood of Enterococcus bacteriuria. They also predicted that dogs with non-enterococcus bacteriuria would respond better to antimicrobial therapy. To conduct their study, the researchers performed a retrospective analysis of clinical microbiology laboratory records, examining canine urine cultures collected over a period of approximately 2.5 years. They identified dogs with significant Enterococcus growth in their urine and compared them to a control group of dogs with other types of bacterial growth in their urine. The data collected from medical records included a wide range of information, such as signalment, medical history, physical examination findings, clinical signs, and urinalysis results. The researchers also evaluated antimicrobial therapy and resolution of clinical signs within 2 weeks of treatment. Additionally, they looked for historical or current diagnoses of various health conditions, including endocrinopathies, myelopathies, gastrointestinal disease, renal disease, urinary calculi, and urinary tract neoplasia. Now, let's dive into the results. The study included 96 cases of Enterococcus bacteriuria and 288 control cases. The researchers found that certain breeds, namely Pugs, bearded Collies, and St. Bernards, had increased odds of having Enterococcus bacteriuria compared to mixed-breed dogs. This suggests a potential genetic predisposition or breed-specific risk factors. Furthermore, several comorbidities were found to have a significant correlation with Enterococcus bacteriuria. These included recessed vulva, myelopathy, chronic kidney disease, and hyperdrenocorticism. These findings highlight the importance of considering underlying health conditions when diagnosing and treating Enterococcus UTIs. Interestingly, lower urinary tract signs, such as hematuria, polyuria, and stranguria, were more common in the control group compared to the Enterococcus group. However, urinary incontinence was more prevalent in the Enterococcus group. This suggests that Enterococcus infections may manifest differently than other UTIs. In terms of polymicrobial infections, the study found that cases were significantly more likely to have polymicrobial growth than controls. This reinforces the notion that Enterococcus often plays a role in complex, multibacterial infections. When it came to treatment outcomes, the study revealed that dogs with non-enterococcus bacteriuria were more likely to have resolution of clinical signs with antimicrobial therapy compared to dogs with Enterococcus bacteriuria. This is likely due to the fact that Enterococcus species exhibit intrinsic resistance to many commonly used antimicrobials. So, what are the implications of these findings? This study provides valuable insights into the unique characteristics of Enterococcus bacteriuria in dogs. It identifies breed-associated risks and highlights the importance of considering underlying health conditions. The finding that Enterococcus infections are less likely to respond to empiric antimicrobial therapy underscores the need for culture and sensitivity testing to guide treatment decisions. The researchers acknowledge several limitations to their study, including its retrospective nature and the inability to standardize treatment and outcome assessments. They also point out that they did not investigate prior antimicrobial use as a risk factor for developing Enterococcal bacteriuria. Additionally, the study sample size may have limited the ability to detect differences in comorbidities between cases and controls. Despite these limitations, this study makes a valuable contribution to our understanding of canine urinary tract infections. It highlights the importance of considering Enterococcus as a potential pathogen, especially in dogs with specific breed predispositions or underlying health conditions. Further research is needed to confirm these findings and to explore the optimal strategies for managing Enterococcus UTIs in dogs. In conclusion, this study sheds light on the clinical differences between dogs with Enterococcal bacteriuria compared to those with other forms of bacteriuria. The results emphasize the importance of individualized treatment plans based on culture and sensitivity testing, as well as addressing any underlying health conditions that may be contributing to the infection. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.